We often discuss diseases, especially the non-infectious ones like diabetes, heart disease, high cholesterol, obesity, and hypertension as separate entities. These diseases are treated with different medications, often with no education about how to reverse the underlying problem which caused the disease in the first place. But this is not the right approach. My name is Dr. Vamshi Bende. I am an internal medicine and lifestyle medicine physician. I specialize in lifestyle disease and diabetes reversal. All of these chronic lifestyle diseases are related, and what makes them related is our underlying core lifestyle habits, some of which are unhealthy diet, lack of restorative sleep, physical inactivity, and excess stress. But here's some good news. Since all of these diseases have their basis in our poor lifestyle habits, once we are able to improve our lifestyle, it treats all of these conditions. Today, let's try to learn how these different diseases are related to one another. Let's say someone has diabetes. Diabetics initially produce way more insulin than normal people do, as their organs become insulin resistant. But this overproduction of insulin causes a lot of problems. Insulin is like a growth hormone. So when insulin is high, it causes another problem, which is weight gain. Insulin also causes excess absorption of filtered water in our kidney. So we end up retaining more fluid, which causes an elevation in our blood pressure. Diabetes is not just a sugar problem. As diabetes worsens, it can affect our fatty tissues as well. When our fatty tissues become insulin resistant, they do not store fat properly, thereby leading to fat leakage into our bloodstream. This causes an elevation in blood fat and bad cholesterol, and it can eventually lead to heart problems like heart attacks. We all know that high cholesterol increases our risk of getting heart attacks, but what you may not know is that it can also increase our risk of getting diabetes, because when cholesterol and fat are present in excess in our body, they can interfere with insulin action and cause insulin resistance, which is a precursor for the development of diabetes. High cholesterol also causes fat deposits in our blood vessels and increases inflammation. This leads to reduced production of a gas called nitric oxide. Nitric oxide helps in relaxation of our blood vessels. Absence of nitric oxide and impaired endothelial function can make our blood vessels tighter, leading to an increase in blood pressure. Diabetes and obesity have what we call a bidirectional relationship, because both of these conditions can increase inflammation in our bodies. So, a person who is diabetic has a tendency to become obese, and a person who is obese is at a higher risk of getting diabetes. In fact, as our body mass index or BMI rises, there is an exponential rise in the risk of getting diabetes, because the underlying process which causes diabetes, called insulin resistance, has already started in them. High blood pressure or hypertension, if uncontrolled and if it goes on for a long time, can cause a particular kind of heart problem called diastolic heart failure, where our heart becomes very enlarged, but as it enlarges, the heart is unable to relax normally, thereby causing heart failure. As we put on weight, our fat cells become larger and larger. Excess fat also leads to insulin resistance. Due to insulin resistance and growth of our fat cells, fats then start spilling into our bloodstream, raising our bad cholesterol levels, which can cause blockages in our heart and raise our risk of getting a heart attack. Also, as insulin resistance becomes stronger, our risk of diabetes rises significantly as well. So, as you can see, all of these diseases are related to one another. And if we can identify and treat the underlying process which causes these conditions, it can treat all of these problems. Treating each condition as a separate entity is like pouring a glass of water on a house on fire. It really doesn't make any difference. But if we can get to the root cause of the fire, we can extinguish the fire before it consumes the whole house.